We are recording. Good evening, everybody. Today we are discussing like health challenges in conflict situations, including war and civil unrest and other situations. So we have two sort of case studies here. Yeah, somebody was asking, will the recordings be shared? Yes, Branilla, yes. So we have one speaker talking about the situation, background, and the situation in Palestine, and then hopefully we'll get some time for discussion on that, and followed by the situation in Manipur, and then some discussion on that. So my role is to introduce KHADIJA. KHADIJA Abukada is a public health physician. Is a public health officer with Palestinian Health Authority, and she works with the WHO team also. And she's closely associated with the National Cancer Control Program Palestine. Like I've known her for some time. So KHADIJA, okay, can I hand over to you?
Yeah.
Yeah.
Well,
so yeah, KHADIJA Abukada will be talking about Palestine. Yeah.
Thank you, Dr. Suresh. Good morning, good afternoon, good evening for everyone, and thank you really for joining this important session about the healthcare situation in the world. I would like first to thank Dr. Suresh actually for this opportunity to present the case of Palestine. And if you allow me, I would like to share a small presentation that I have prepared. Meanwhile, if you allow me, I would like to stop video just for better connection, then we can open it again. So I'll start sharing my presentation.
Yeah, please.
Okay. So you can see it?
Yeah, it's fine.
Yes, please. So as we all know, the humanitarian crisis usually occur when a large people of people face critical health, safety, and welfare issue due to conflict, natural disaster, or other emergency. In such a crisis, healthcare becomes essential, not just for survival, but also for recovery and for maintaining dignity. Today, we will explore the challenges and the responses related to the healthcare in Palestine, which is a region that frequently affected by conflict and the humanitarian challenges. But first, let me provide you with some context about Palestine for the one who does not know about my country, including its demographic and the history of its prolonged occupation. So you can see on the map that Palestine is situated in the center of Middle East. It is bordered by Lebanon from north, Syria, Jordan, almost to the east, and we have also Egypt to the south. Palestine covering a small area. It's not too big. It's around 2,700 kilometers squares, and it's divided into West Bank and Palestine and the Gaza Strip. So here is our history, and here is our story with the build in our memory, in our dreams. Palestine and today's conflict has deep-rooted in the early 20th century. It didn't start newly. It has begun years ago. If you see the first map, you can see what we usually call it in Palestine and what all Palestinians dream about, having a historic Palestine. The historic Palestine, it's in green. And we hope that one day we can have it. When it was almost 100 land have been occupied, and the Palestinian people have been living in this area. And the dramatic changes and the significant changes have occurred after 1967, leaving Israel in control of the Gaza Strip and the West Bank area with large Palestinian population. Unfortunately, since 1967, Israeli expansion over the Palestinian land has continued, and nobody knows if it's going to stop or not, leaving only 50%, which is in the green. You can see it now, how it is scattered, how it is over-distributed along the Palestinian people. It's only 15% out of the 100% population. So you can imagine the frustration and the consequence of such changes that we have been living during the last years. Looking to the pre-war healthcare situation in Palestine, I would like to give just a landscape about our context. As I mentioned before, the ongoing Israeli military occupation has profoundly affected the region on the social aspect, on our economic, and actually imposing numerous restrictions and challenges on the daily lives of every Palestinian. Regarding the geographical division, and because of this political situation, it has been divided, as I mentioned, into two areas, into West Bank, into Gaza Strips. These are the main region. However, we also have the East Jerusalem. We have also inside the West Bank, it has been divided into another component, into Area A, Area B, Area C. Even inside some cities in West Bank, it has been divided into H1, H2. Actually, this is not the Palestinian choice. This is because of the Israeli control and the Israeli policies and regulations. Gaza Strips. The sad story of Palestine. It has been under blockage since 2007. So imagine that you are living in a prison where you cannot leave, you cannot go out, or you cannot go into this city, to this population, or to this area, having a very severe restriction on not just the movement of the people, but also on the goods, on the supplies, on the medical facilities, and everything related to the life of the Palestinians. This leads eventually to humanitarian crisis and economic decline. Regarding the economic indicator in Palestine, I think you can imagine Palestine have been classified by the World Bank as a lower middle income. This is because of the GDP, which is in Palestine, it's around $3.664. This is really very low in comparison to the region neighboring countries, and this is really highlights the economic challenges that the Palestinians have to live with. The economy heavily impacted by restriction on the trade, on the movement, and the prolonged conflict, with nearly 80% of the national GDP only coming from foreign aid. So imagine a country that has to depend on donor and on fund from different countries. We have the big problem, which is the prolonged refugee hold. Maybe it is the only country that have been experienced this. 70% of Gaza population and 28% of West Bank population are refugees. Either they are living in camp inside West Bank and Gaza, or they are living and have been displaced to other countries, and they are living in a very poor living condition and with prolonged displacement and dependency on it. If we want to look to the determinant of health, despite that the Palestinian conflict is highly educated, I need to be proud of this. We have almost 95% of literacy among our population. However, the employment is very critical, it's very high. 44% in Gaza and 40% in West Bank. So the living of the youth who are graduated from university, they cannot find any job opportunity, and they cannot really enjoy the life similar to the other people. Food insecurity is very alarming, even before the war. We are talking about 32% of the population in West Bank and Gaza severely facing from severe food shortage. Impacting, actually, this would impact their physical, mental well-being, especially among the vulnerable people in and marginalized areas. So this is just the landscape. This is just the context. If we want to look to the demographic, as of January 2024, Palestinian population stands for 5.43 millions, with 22.17 millions in Gaza Strips and 3.18 million in the West Bank. This is without counting the people who are living outside of Palestine or are living in the East Jerusalem. If you look to the pyramid of Palestine, we are happy now because our population is young. We have almost 50% of our population is under 14, which represents actually a unique healthcare challenges and demand. While the people who are at least 65 years and more, they account just 0.29% of the population. However, this proportion, there is a lot of projection about the increase in this population in the long run. and very fast. And imagine the health system, how they can. Regarding the male to female proportion, we can say that it's actually equal. We have 50.1% female and versus 49.9% female. Actually, all these indicators and all these statistics have been extracted from the most reliable source of information in Palestine, which is the Palestinian Central Bureau of Statistics. I would like to give just a picture about our health indicator, key health indicator. In fact, before the recent war and the recent conflict, Palestine exhibited a notable health outcomes, which in such situation that it was able to manage and to succeed in achieving a good health indicator. So, for example, we have almost 99% of immunization coverage. We have a life expectancy around 74.1, with no differences between West Bank and Gaza, not major differences actually. Regarding the infant mortality rate and the under 5 mortality rate in comparison to the neighboring country, I think we have been doing good. It's around 12 for the infant and 17 per 1,000 for under 5 years. However, the maternal mortality ratio was 27 per 100,000 live births. However, some reports show it might be underestimated and might be reaching 48. So we are not doing good really actually on this area. Also, we have a good fertility rate. It's 3.8 in West Bank and 3.9 in Gaza Strip. Actually, we are a fertile population, and this is also part of consequence for the demographic war that we have with Palestine also. In 2023, actually, chronic disease continue to be a significant public health problem. Depending on the last stepwise survey that have been conducted by the WHO and by the WHO, we found that 20% of individuals at the age between 18 and 69 years old, they having some type of chronic disease. While almost the female have been affected by chronic disease more than male, and the bad also that some people having 2/3 of the population having more than one non-communicable disease. Unfortunately, tobacco use is very alarming in our condition. We are considered as being the first country in the region in tobacco use, especially among the youth. It's around 33.9% for the population of 18 to 69 years old. This is just in summary, but there are more, of course. If we want to look to what causes the most deaths in Palestine, again, it is the non-communicable disease, where ischemic heart disease is the first one that causing deaths. It is according to 22 data. It's in both in West Bank and Gaza, and also Palestine have to deal with a huge burden of cancer, where actually it is account for the second reason for deaths among population. Okay. Let's have a look to our healthcare system in Palestine. With such challenges, what are the consequences? Actually, the Palestinian health system consists of 4 main providers. We have the large proportion of health services are provided through the governmental sector, which is through the Palestinian Ministry of Health, and we have also the military medical services. The second sector, which is of course of the refugee, it is the UNRWA. It's the United Nations Relief and Work Agency, which actually has been established just to serve those people. And actually UNRWA is serving much more in Gaza than in West Bank, just because of the refugee proportion in Gaza is much more. Also, we have also a large contribution for the non-governmental sector in Palestine, and also we have the private sector, which is actually during the last 10 years has been doing some investment and expansion in terms of services. All these 4 sectors, they are trying to provide the different level of the healthcare services. We are talking about primary, secondary, tertiary, and trying to collaborate and to coordinate as much as possible. So, for example, if we want to talk about the primary healthcare center, there are around 767 primary healthcare centers, and from this table you can see the classification that most of the primary healthcare center belongs to the Ministry of Health with around 65%. Also, the UNRWA, the NGO, and the Palestinian medical military, as I mentioned, indicating actually, as I mentioned before, there are 600, almost 600 in the West Bank, and around 159 primary healthcare center in Gaza. Each centers serve approximately, imagine, 6,576 citizens. This is indicating a stretched but a crucial primary healthcare network. Looking to the secondary and to the tertiary healthcare in Palestine, include hospital. We have actually, you can see the number of the hospital in Palestine that has been distributed according to the sectors. And also I try to provide some indicator about the occupancy rate and about the beds. Actually, it's important to look to the availability of the hospital, but also it's very important to look to the availability of specialized and general services. We have different kind of hospital. We have the general hospital, and we have the specialized hospitals that are specified for special services. However, the occupancy, the health system is really having a hospital with high occupancy rates. In some hospitals, it's over than 100. And this is reflecting the demand for secondary and tertiary care. As I mentioned before, specialized hospital and general hospital are organized based on a well-established hospital master plan. So it hasn't been established, or it hasn't been distributed among the different districts in West Bank and Gaza randomly. It's according to a well-established document that have been developed by WHO and the relevant stakeholders. Rehabilitation centers. Palestine having 5, but unfortunately they are non-governmental. We don't have a governmental rehabilitation center. We have 3 centers with around 135 beds in West Bank, and we have 2 centers with around 110 beds also in Gaza strips. Additionally, we have Palestine maintains over 300 labs at primary healthcare, at hospitals, and at central level across West Bank and Gaza, with a varied level of advanced technology, and well equipped with the necessary tools and necessary tests and supplies. Even for, as I mentioned, they are trying to adopt the necessary technology to be able to sustain this service in good quality. Blood services, which is very important. I'm gonna say now why it's important for Palestine and why I'm focusing on the rehabilitation and in blood banking, and we have a national blood bank. I think the presence of this facility along, I mean the rehabilitation center and the laboratory, the blood bank services, and the national is crucial in meeting the health needs of population like Palestine. This population who having a high proportion of injuries, who have a high proportion of disability-related injury and war. And it's very important to invest in the availability of blood services and national blood bank to ensure the availability of blood supply, to be able to manage the urgent and the emergency situation, which is very happening every day in Palestine. Human resources. The healthcare system is supported by a comprehensive health workforce. We having doctors, we having available nurses, midwives, different workforce. For example, the density of this workforce is 1.1 doctor per 1,000 population, and this is very satisfying in comparison to the neighboring country. However, we are facing from the regional availability and the distribution. There are significant disparities in the distribution of healthcare professionals across different regions, where actually the center and the north having much more and having the luck to have more workforce than the south. West Bank also having more than Gaza Strip in some specialty, and this is leading to shortage that can affect the quality and the accessibility of care. While there are a well-established nursing and medical schools, we have around 10 nursing schools who are providing a bachelor degree and different master and PhD program. We have 4 medical schools, they are providing a medical degree, in addition to the other undergraduate providing academy in Palestine. We have a good licensing system, we have good registration for our nurses and for our doctor and for all healthcare providers. However, we still, Palestine suffering from shortage of a certain specialty at primary and secondary health, and we have very limited opportunity for specific training and for specific specialization. Palestine also, the workforce having a few challenges. It's not much. We have the issue of brain drain, because of the political situation, again, because of the working condition that our workforce have to live well. They find the choice sometimes to live and to work in other countries, and this is really stressing and the health system in Palestine. Also, the workload in some facility, in some area is another challenge that the Palestinian system complaining of. What are the key challenges and the barrier before the war on Palestine? Of course, the political situation, and I think now you have you were able to become able to build a picture about the decay of the long-lasting, how they are affecting the stability and the development. And this is making most of our work is humanitarian without giving us the space to invest in the development. However, we are trying to do our best in this area. There is a lot of movement restriction and import limitation, a lot of checkpoints, a lot of restriction in the import of certain supplies. And for example, Palestine unable to procure radiotherapy. This is because of the Israeli regulation that preventing our Palestinian Authority from having certain materials to be able to make these services functioning. That's why we don't have any radiotherapy except in the East Jerusalem hospital. Of course, the biggest challenge that we have been facing before the war, and it is the blockage on Gaza. The continuous blockage in Gaza since 2007, having its detrimental effect, not only on the health sector, but actually in every aspect in the life of our Palestinians who are living in Gaza. The financial barriers, Palestine is very limited in terms of resources. They are heavily reliant on donors for funding. And actually, we have been facing a very recurrent physical crisis. And during the last 10 years, we have been facing the problem of, I don't know if you heard about that in media, is the tax holding by the Israeli Authority. Another barrier and another challenges for our health sector is the chronic shortage of the essential medicines. For the NCD patient, for the oncology patient, imagine that you have to refer a patient from Palestine to another country just to receive a systematic therapy because it's not available. It's not because that Ministry of Health doesn't want to have this drug, but because of the limitation on the import, make the availability of these drugs very challenging for our health sectors. Not only medicine, also for certain supplies, sometimes for laboratory tests, sometimes for diagnostic technology or something like that. As I mentioned, we have all issue of health care workforce and the human resources. Yes, we build our system with our competent health workforce, but still there are a limited and lack in specialized workforce, limited training, limited education. Also, we have a problem with the access to specialized care. I give an example just right now about the radiotherapy, about bone marrow transplantation, about the other treatment that might be needed for patient and depend really specialization in terms of the physician who gonna do this services or in terms of needed for surgery or for material. Lastly, we have also of course, the environmental and the social determinants. Poor living conditions, overcrowded, especially in the marginalized area, in the camp, actually have its effect on our health outcome and health status. The unemployment rate and poverty, and you can imagine how this is high in Palestine, and I'm sure the literature have shown the evidence how much these indicators and how much of these social determinants affecting the health of people. Limited access to water, where the share of the Palestinian citizen for water, imagine, it is less than the minimum allowance amount, and this is due to the control of Israel on water sources and being able to controlling the distribution of the Palestinian water. So imagine that you are living in a facility that you cannot have water except 1 day per week. How much this will be sufficient to be able to practice the wash and the needed practices to keep you healthy. Despite of all these challenges, the Ministry of Health has made significant development and have been able and have been committed to achieve the universal health coverage and to be able to provide services with quality for its citizens. This has been done through different health policies and different strategy. We have a national health strategy that really focusing in our national priority and our national lead. There is a lot of investment in the health insurance, trying to minimize the out-pocket money from the people and trying to bridge the gap with the unemployment, with the poverty. Also, they have been investing in health care infrastructure development. There are a lot of the public health initiatives that have been supporting and working hard to sustain in order to be able to serve the people as much as they can. For the health workforce have worked hard to build the National Health Workforce Observatory, which is the first in the region. And according to this workforce observatory now, a lot of effort now is going to having a national strategy for recruiting and for education for the health workforce. For sure, Ministry of Health invested heavily in the emergency and the response and the preparedness program. They established its own program and they keep collaborating and partnership with every organization that can support. Also invested heavily in the digitalization of health to make sure the health information system and to make sure that the health the decision making and any action that will adopt based on evidence-based and based on information. So the war in Gaza, which has started in 7th October, and I think now you have built your picture why we reached to this point. It's not just because of one day and night. It's because of the long years and the effect that have been for many years. So this is just I'm trying to give a picture about key highlights of the situation for Gaza Strip. This is based on a dashboard that have been extracted from 26th of June. Unfortunately, we have more than, actually today it reached 39,000 fatalities in Gaza. We have more than 86, actually today it's 89,377 injury. We have more than 10,000 of people who are being under the rubble, and I'm thinking that the number is much more than. Actually, this war did a huge destruction, not on the infrastructure only of the health sector, but also destruction on all aspects of our life in West Bank and in Gaza. This war has been alarming because of its vigorous health attack. As of June 25, around 474 health attacks on our different health facility and our health teams. Around 740 health staff and people have been killed in this attack. We have more than 100 of our healthcare workforce have been injured in these attacks also. We have a huge number, not only 120 health workers remain detained and arrested. We have also more than 100 health facilities affected, 32 hospitals has been damaged, and 115 ambulances have been affected, and 63, I can't read it very well, sustained. So actually, as we say in Arabic, this is a destruction for stones and for human from every aspect. We have the issue of on the effect on our malnutrition. The food security and the starvation are very alarming in Gaza, with disrupted health, water, waste, and sanitation systems, forcing people to live in a critical condition. Actually, this situation has led to significant rise in malnutrition and infectious disease. So imagine now there are a lot of reporting about cases of acute respiratory infection, more than 500,000 of diarrhea, the cases of scabies and lice, all these related for the simple availability of food, supplies, and others. So it's really, really alarming, and this is really need a rapid intervention as early as possible, especially with the food starvation that our people has to suffer from in Gaza and in every aspect of West Bank. Okay. Being under a blockage, even with the blockage of Rafah across the other border that used to be the entrance or the exit fee for Gazan people, this continuous blockage at all entries have exacerbated the health crisis, with the humanitarian aid truck awaiting entry. Further complications such as access to essential health services. So imagine that the vaccination rate, where we have been very proud that we were able to cover more than 99% for in some disease, it's now reduced. The antenatal care and the postnatal care, all maternal and child health services have been also reduced to the minimum. Also, providing the essential care for the people with the chronic disease. Before the war, there was more than 350 people who have been suffering from NCD. We are talking about cancer. We are talking about people in need for kidney dialysis. Now they have been prevented and denied access from having these treatments inside Gaza or having them the permission to go out of Gaza. Lack of mental health care. So imagine the mental status of our people. And it's actually a lot of reports showing the increase. Yes, our Palestinian people are resilient, but nobody can ignore the effect of such situation on our mental well-being and on our mental safety. As I mentioned, there is high risk of infectious disease outbreak, and actually there is also the rehabilitation phases and numerous challenges. All these will lead to increased indirect morbidity and mortality. Medical evacuation operation, it's conducted in collaboration with various stakeholders, and I'm proud to say that I have been involved in some of these with a lot of obstacles and a lot of constraints. There are around 10,000 sick and injured people awaiting for medical evacuation. It's only 2,000. We are talking about 35% from the one who need to be evacuated. We were able to provide this evacuation. However, the majority of our people who are in need, they are still waiting for the approval from the Israeli, or they have been denied. You can see from this graph that the most cases that have been evacuated is cancer, and I can guarantee that most of them have been child with cancer. A little have been from the person who have been injured, patient with kidney dialysis, and these are the most one who have been evacuated. However, the majority are still waiting to be evacuated. So West Bank, what we usually use the term is the second lung of our country, the second lung of Palestine. It also has its share from this war. So I'm going to give just a very fast about West Bank. the challenges that Palestine have to live with after the war. So imagine the previous challenges, West Bank have to live more. So there is an escalation of military and settler violence. The settler have been attacking the innocent people who have been moving from one city to other. They have been attacking the houses for people. They should suppose that a person has to be safe in his house where he has closed window and a closed door, but the settler, they're going to burn these houses and to kill as much as they can. Also, the recurrent physical crisis, which is worsened during the last 5 or 10 years by tax withholding by Israel, and actually this is lead to shortage of essential medicine supplies and medication. Actually, more than 40% of essential medicine actually is out of stock for the Palestinian Ministry of Health. Also, because of the financial crisis of the Palestinian government, this lead to reduce the salary. The salary for the people who have to live with unemployment, to live with poverty, they have to live with the huge prices. So they have been taking around 50%, sometimes 60% of their salary. So what's the option they have to accommodate with such changes? They reduce the days of operation at clinic, reduce the capacity as hospital, but they keep 100 coverage in emergency and in case of an emergency center, just to have no effect on the other people. Also, the obstruction of access to healthcare. And this is because of the closure of checkpoints during the war on Gaza. They closed all the checkpoints. You know, the checkpoint, it's allow me to pass from one city to other city in Palestine. So it has been completely closed during the war, and this has led to movement restriction. Even when they allow people and when they open these checkpoints, they keep people around 4 to 5 hours just to allow them to pass this checkpoint to reach, for example, a hospital or to reach a facility for. So even this is also for the ambulances, also for the medical health team. As I mentioned, obstruction of ambulances services. Also, the health attacks. I'm gonna having just one slide about what the health attack. Also, one of the challenges that we have to live with currently is the forced displacement of more than 4,000 Palestinians. They have to be displaced from their home in the West Bank. Actually, the area that have been bombed, for example, in Jenin, in Tal Karim camp, they have been displaced to other cities to live with their relative or to live for other areas. As of 1st July, we have 556 fatalities between our innocent people. We have more than 5,000 injuries that have been across the different district and governorate in our West Bank, and the number are increasing, and the expectation that these attacks and these number might increase in the coming days. Unfortunately, health attacks also happened to our West Bank colleague. According to report, there are more than 466 health attacks. In these health attacks, around 12 people. When I'm saying 12 people, it's mostly the people who are working in the health sector and the people who have been driving or providing emergency in these ambulances. 95 people from who have been on these health facility or have been in these health ambulances have been injured. 53 health facilities affected, including 19 hospitals have been damaged in West Bank. 311 ambulances have been affected. 334 have been obstructed access. 74 ambulances have been detained, and they didn't allow them to reach the injured people and consequently these injured people have died. 220 use of forest, and unfortunately 86 militarized search of vehicles. So again, the health access is an issue for West Bank because of the movement between the governorates and the cities within the West Bank remain challenging. People cannot reach for the near primary healthcare facility just to, for example, to have a vaccination for their kids. or a high-risk pregnant woman cannot go for her appointment just to receive the treatment. NCD patient cannot go to the nearest primary healthcare facility to have his medication. Our cancer patients, they have to go weekly for East Jerusalem to receive chemotherapy and to receive radiotherapy, because East Jerusalem having the only radiotherapy. So imagine that patient have to be denied access for a month from having this session of radiotherapy and chemotherapy. So, response. Scaling up the emergency health response for the population to reduce mortality and morbidity in the setting of current escalation of hostilities. Actually, a lot of international organizations like WHO, like Red Cross, different UN agencies, various NGOs play vital role. And the WHO operational response plan have been developed and have been operated since the first day of the war in Gaza. And this has been built in collaboration with the Ministry of Health and also in alignment with the other donors and with other stakeholders working in this area, trying to support the Gaza health system as well as to support the West Bank system. Actually, we have been trying, and through this operational response plan, we have been trying to support the health system through delivery of essential health services as much as we can, with a lot of challenges. Public health intelligence and early warning, prevention and control, supplies and logistic support, which is really alarming and was really very critical. Early recovery, rehabilitation, and reconstruction for the facilities that have been destroyed, and also focusing on partner coordination to make sure that there is a matching in work, there is no duplication, and to provide the best services for our people in Gaza and in West. So moving ahead, this is the nature of Palestinian people. They are in the middle of the crisis, but they have to look on the future. We must consider the future outlook for our Palestinian healthcare system, and I think this is the dream, and this is the vision for most of the people who are working in healthcare system. So, first of all, we have to consider the prolonged effect and prolonged conflict that has disturbed healthcare services, raising concern about the long health term problems. What is the long health term that will be seen in the future? Okay, now we can see the fatalities, we can see the injuries, we can see the poor living condition, we can see the malnutrition. But what is next? So it's very important to consider the long-term health issue. Also, rebuilding the healthcare system. Strengthening our healthcare system structure with international support is essential, as well as with our local and with our Palestinian people. This investment will help meet urgent healthcare need and improve health outcomes. As I mentioned before, we have been in a humanitarian throughout all my life. Since I have been born, or I am aware on myself, I feel, and this is the only thing that I see in my life, being in a humanitarian. However, we have been also working in development. As Dr. Suresh, when he introduced me, he said that, yes, we are in the war, but I have been working on developing National Cancer Control Program and strategy and action plan. So yes, we need to focus on a humanitarian, but we should not forget the development and the investment for our future. Peace, and I prefer to call it ceasefire, peace and stability. And if you ask me, I would prefer to keep it the first one. Improved achieving peace can significantly, and ceasefire can enhance the healthcare access and equality. A peaceful environment, stability, allow for expanded health services, equitable access, fostering healthier population. I kept this slide empty. I want to highlight in this slide, the resilience of Palestinian people is remarkable. Yes, nobody can ignore that. However, collective action is needed. Everyone can contribute to sustaining peace, to upholding human rights, and improving the quality of life for innocent people. And if you allow me, they can contribute to keep people living. Nobody should die because of war. I want not go beyond that. I think everyone can contribute in the way they can to sustain the life which is a basic human right for all people, regardless any other characteristics. So last but not least, I want to share this photo, which has been raised on. It's for a resilient woman who, despite losing her land and seeing her trees uprooted, still believes in non-violence response to the injustice she faces. Her strength and preservedness are powerful reminder of a human spirit's capacity for resilience and hope. Thank you so much for your listening, and I hope that I didn't take a lot of your time, and I am willingness to give any answer or clarification. Thank you so much. Thank you.
Thank you, Khadija. That is actually the comprehensive picture and also well articulated. We are short of time, but I think we can afford to spend 10 minutes on questions and answers and discussion, because this is a really important theme, and you actually presented a lot of questions also. What do we do? So over
Yes.
for the it's open for general discussion. There are quite a few comments in the chat box which you can see. If anybody wants to ask something,
Yes.
maybe we can have 10 minutes. Khadija is around, and there are also some other colleagues from Palestine. Abdullah is there. So 10 minutes for any possible comments or questions, and then we move on to the next one, to the floor. Okay, you can unmute and either raise your hand and unmute and speak, no? Because yeah, the in addition to the chat box.
Yeah, if I can start the discussion, I have just one doubt in the
Feroz, please.
Yeah, this is Feroz here. One question to to Khadija. See, I found the health indices very attractive in Palestine. Before war, you said it was, the infant mortality and under 5 mortality are very, very promising and very good. The health services, I was looking at the chart. Health services, I found that the government health services almost covers 2/3 of the health services in West Bank, but only 1/3 in Gaza. I was wondering why it is like that and what is the politics behind that. The second question is, when only 1/3 is covered by government in Gaza, the NGOs are covering a lot more, and you have another column called the private. So what is the difference between this private facility and NGO facility, which both are outside the government sector? So 2 questions: why the government is less in Gaza health services, and what is the difference between NGOs and private?
Okay. Dr. Suresh, you would like me to answer now?
Yeah, please, Khadija.
Yeah. Thank you. Thank you so much for your question. It's very a very clever question. Thank you for asking this question. Actually, why it's the governmental contribution in Gaza is less than in West Bank? This is because of the demography of Gaza. As I mentioned, 70% of the population in Gaza is UNRWA. Refugees. So refugees, there is the big institution which has been established to serve these people, which is called the UNRWA, which is the United Nations for Relief of Refugees of Palestinians. So most of the services in that's already in West Bank has been copied in Gaza, but has been provided by UNRWA. It doesn't mean that if the service not available through the government, the service is not available. That's why maybe because there is a lot of information, I cannot give it in one presentation, but there is the national policies that coordinate between the different sectors, including the UNRWA and including. So once the Ministry of Health build the national strategy, it usually built in collaboration with the different stakeholders, including the NGO, the private sector, the UNRWA. And from this, everyone can share what contribution they can do. So the first rationale why governmental services is less in Gaza, that's because of the population there is the refugees. But for sure, the services that are provided for citizens in West Bank, it's already provided for our citizens in Gaza. Your second question is about the difference between NGO and private. When we see private, it's actually a profit facilities. Either we are talking about hospitals, we are talking about laboratories, which is very common in Palestine, actually, the private sector. The NGO, it's as it mentioned, it's non-governmental, but also it's non-profit. So usually they provide services for people who are not having, for example, insurance for governmental, and they are not refugee. They can receive the services from these NGO facilities without paying and without out pocket. And usually the NGO is mostly for primary healthcare services. We are talking about the primary healthcare level of healthcare in Palestine.
Thank you, Khadija. Yeah, please.
Suresh,
Yeah, please.
question. Can we get a disaggregated figure of health facilities in Gaza and West Bank in Gaza, and what is the health indices in West Bank? Can we get a differential statistics? Maybe the indices you have projected were for both. Can we get a differential? Yeah.
Disaggregated. Disaggregated, you mean the primary healthcare or the hospitals?
For Gaza and for West Bank.
Regional differences. She's asking about regional differences between Gaza and West Bank.
West Bank. Before October 7. I am talking about before October 7. Yeah.
Doctor, I think I shared these this aggregation in the table. I tried to put how many, for example, hospitals in Gaza, how many hospitals in West Bank.
Not the hospitals.
Also by the sector.
It's asking about health index, the mortality, infant mortality, immunization.
Yes.
Is there any difference between the two, or
you are talking about the. Okay. So you are talking about the health indicator. Yeah.
Yes. Difference between
actually,
Gaza and West Bank.
Yes, actually, I tried in my presentation when there is differences between Gaza and West Bank to highlight it, because in our Palestinian Central Bureau of Statistics and our Health Information Center in Ministry of Health, also in any data, we usually disaggregate any health indicator by Gaza and West Bank. I tried not to overwhelm the slides, but actually for the indicator that I have presented, there were no differences in terms of infant mortality, in terms of life expectancy, in terms of maternal mortality. The only, if you noticed in my presentation, it's for the fertility. It was in West Bank, different from Gaza. So actually, we are do this in our statistics, and for sure, if anyone would like to see any more disaggregated data, we can share. But for sure, the health indicator is usually mirroring each other with a minimum changes between West Bank and Gaza.
Thank you.
Maybe we can take one or two questions more and then conclude. Something that I noticed, the sense of resilience, because even in the middle of all this, you are still thinking about the future, and that's really wonderful. Admire.
I just want to, I'm Brunel from Bombay and from the Tata Institute of Social Sciences. I want to thank you for a very wonderful and inspiring presentation, and also tell you and the people of Palestine, especially Gaza, that we stand in solidarity with you all. And if there's anything that we can do besides solidarity letters or whatever, do let us know, and we will see how to support you even from a distance.
Great. And
Thank you.
Yeah, thank you very much. Anybody wants to make one comment? And Anand was asking, what can we do from here? So I think that the Brunel also echoed the same spirit, no?
Your education systems may be totally disrupted. So I was actually talking to a friend who's very active on the Palestinian cause, that if there are online programs that we can support, so that we would be happy to support those online programs through teaching and through working with jointly with for curriculum development and things like that.
I'd like to respond to Brunella, please. Brunella, they already have online courses, university courses and school courses in Arabic that for Palestinians, both in the West Bank, Gaza, and in Egypt. The only issue with Gaza is the internet connection.
Yeah, I'm sure, yeah.
And so that's a major problem with Gaza. In terms of facilities, I think we should try, evacuations are happening. And injured children and women especially are being evacuated to Gaza, to Egypt, Turkey, the UAE, Qatar, even the UK and Italy. So that's a possibility also, I think, which we need to push our government to be able to offer facilities for treatment.
Yeah.
Thank you.
Can I
comment, please?
Yeah. Please.
Yeah. So actually, thank you for your for contribution and for being with the Palestinian people in every aspect in this war. And actually, I don't want to add more about the online training, because there has been a lot of initiative, as our colleagues have mentioned that here. And actually, imagine that the Islamic University, which has been bombed many times by the Israeli, now they are started with the online studying from the heart of Gaza. This is, I just wanted to share with you this information, just to show how much we are trying to be resilient and how much to survive and to recover even while we are still in the middle of the war. About the medical evacuation, yes, I have been involved in many medical evacuations, especially for the children with cancer. It was at the beginning of the war, and it was one of the hardest operations at that time. Maybe now it's less, but still. And I really echo what you have mentioned now. It would be very more influential if we could work on securing the necessary treatment, the necessary supplies, so they can have it in Gaza. Because what is happening with the medical evacuation, that sometimes they don't allow for the right person to go out with the patient. So imagine when there is a 5-year-old children or 3-year-old child, he has to leave while he has a cancer. He has to leave with his sick grandmother. So you have to deal with a sick child, and you have to deal with the grandmother who probably having NCD disease. And imagine the separation and the effect on the psychological and the well-being of the child. So maybe working on securing more materials, medication, supplies inside Gaza would be more beneficial than depriving these people from their right of access to treatment in a good environment.
Thank you. We'll have one
Can I
last
ask-
comment or question by Anthony, and then we can go. Yeah, because this
very
can go on.
moving presentation, Dr. KHADIJA. We express our solidarity. Leaving that aside, I want to ask one question. Is there a firm stand by the health staff of the government and the health activists outside the government that Hamas should not use hospitals and health facilities as a shield for their political attacks, whatever it is, benefit of Palestine? Why should the patients and children and wounded patients be caught in the crossfire? So is there a firm stand on that?
So I promise myself, my friend, not to talk on politics. But for sure, nobody using his facility, at least as far as I know, because I have been in Gaza just 1 month before the war. No one have been using any health facility for for Hamas or something like that. So, and actually a lot of the investigation that have been going on have said and confirmed this information. So this is the only thing that I can reply to your comment. Apologize if I didn't get your point. Thank
No,
you.
no, it's clear. It's clear. It's clear.
Thank you, Khadija, you did.
Yeah.
So that
Yeah.
is again, it's quite a lot of stuff, more stuff to be discussed,
Yeah.
and a lot more people interested, but we have shortage of time. Khadija, I'm constantly in touch with Khadija, so we can get the team, and we can get them back for some further discussions whenever we want. And also, like we continue. We need to continue this because this is not a one-time intervention. This is actually a sensitization about what's happening in Palestine, so that people can intervene, people can support, and be in solidarity. Thank you, Khadija. That was really good, and we understand what situation you live in and what sort of fights that you do. Thank you for sharing. And then we have the next session on situation in Manipur, and I think Anand Sakaria is there. I hand over to Anand to coordinate. Anand?
Yeah. Can you hear me, Suresh?
Yeah.
So I'll introduce SHEM Romai. He's the head of Disaster Management and Mitigation Unit from the Emmanuel Hospital Association. Emmanuel Hospital Association is a Christian organization which works right across North India in the most deprived parts, providing hospital care, primary care, and he's the head of the disaster unit of the Emmanuel Hospital Association. He's been involved in disaster relief since 2006, and also in the training of volunteers, of more than 10,000 volunteers across India and Nepal. EHA got involved in medical relief in the camps in Manipur from very early on in the conflict, and they have been involved in providing relief for last 9 months on both sides of the conflict. So I have had the opportunity to work with the team in EHA, and I've learned many things from them about responding to the situation ground, working across agencies, non-partisan nature of relief, the safety and support of volunteers, and how well organized they have been. And I must say that in the 9 months of the thing, they have made sure that there are no major problems and incidents for the people involved. I'm going to hand over to him to talk about both the Manipur situation as well as the work that he has been involved in, so that we can all learn from that.
Thank you. Thank you very much, Dr. Anand, for that introduction. And first of all, I would like to congratulate Medical Friends Circle for your achievement as you celebrate your 50th anniversary. And when we talk about Golden Jubilee, it comes to my mind that Jubilee is all about liberating someone or forgiving someone, restorations and reconciliations. And today in our country, there's been, as we also just heard from KHADIJA, there's been death, destructions, and separation in our country. So I pray that the MSC message for the Golden Jubilee celebration will be to bring reconciliation, restoration, forgiveness, and liberty in our country and in the entire universe. So that's my prayer. And I will quickly share my slide, and I will be quick. I will not, I do not have too many slides. Yeah, so Dr. Anand already introduced about EHA. I'm not going to say more. We are a network of 19 hospitals working in the north, central, and northeast of India. So this is all about EHA. And before I go to the problems, let me quickly share some background about Manipur. As most of you already know, Manipur is located in the northeastern part of the country, India. And Manipur has about 2.7 million people, about 28 lakhs of people. And the map on the left side, if you see, I have marked the valley and the hills. So the hills comprises about 90% of the geographical area of Manipur, and the valley occupied only about 10% of the geographical area. And in this small states, there are about 39 communities, tribes and communities. So you can already see, as I talk about the historical background, it will be social, cultural, and the political background. So a small state with 2.7 million people and 39 communities, and all these communities are unique in their own way, and so they speak different language. So there are multilingual. It's a multilingual state, and multiculturals, and also multi-ethnic. And the major communities are like the Métis, the Nagas, and the Kukis. And there are a lot of smaller communities, and also few of you may surprise to know that there are a good number of Jewish communities in Manipur, in more than 10,000, and we also have a bit of Tamilan village, and a good number of Bengalis, Marwaris, and Sardars. So this make the state Manipur. And to give little more information, so in the valley, the Métis, and also called the Métis Muslim, the Pangals, they live in 10% of the geographical area, that the population is about 57 of the populations are Métis and the Pangals, and only about 42 or 43% of the 90% geographical areas are the Nagas, Kukis, and other tribes in the hills. So this is very important because the conflict, one of the main reasons that of the recent conflict was because of the land issue. So those 57% who live in the 10 geographical area, now because the population is increasing, they need more land. So this is that's why the High Court of Manipur has given an advisory to the government of Manipur to ask the Métis community, which is a general community, to ask for the status of ST, the settled tribe, and so that's where the trigger point of the violence. And on the 3rd of May, there was a protest organized by the All Tribal Student Union of Manipur, so comprising of the Nagas, the Kukis, and the other tribe. And on the 3rd of May, the problem started in the district called Chorchampur, which is on the southern side. And then that's how it started. So this is a few backgrounds so that you will have, when I talk about problems, you will have little more clarity about the state. And today is 4th of July. It started on May 3rd. So it's already, yesterday it completed 14 months. And the situation, let me tell you, it is still, I would say there's not improvement even today. So it is as same as the last 14 months. The situation is still very grim over there. And yeah, this is the population, 10% of geographical area, and 57 and 90% of geographical area, and about 42%. So this is one of the, and on 3rd of May, the conflict started, and it has affected about 1 lakh of people directly and indirectly. Number of people who are internally displaced are about 70,000, and people staying in relief camp are about 56,922. More than 10,000 people have migrated to other states like Mizoram, Assam, even Delhi, Bangalore, and so in Kolkata, in many places, more than 10,000 people are displaced, and within Manipur, in the relief camp, there are about 56,922 people are in the relief camp. So the affected district, out of the 16 districts in Manipur, 9 districts are affected, and these are directly affected, and the other rest 2-3 districts are indirectly affected. Human life loss as of the government official is 223, but on the off the record, there are more than supposed to be more than 222. So, but as per the government record, it's 223, and about 6,000 people injured, and number of house damage are 4,786, and number of religious structure damage 384, and recently, last couple of weeks back, there was more destruction, so that the damage in terms of house and will be a little more than this. And number of relief camps within Manipur is about 320. There are 325 relief camps, both in the hills and the valleys, in the valleys and hills. So these are the 9 districts which are majorly affected. About the hill, both the hills and the valley. So these are the 9 districts. Yeah, you can see. Okay, so few. Let me just share some of the things. So according to the media report, most of the children below the age of 6 in the camp suffer fever and diarrhea, while nursing mothers and babies face a lot of discomfort and inconvenience. So this is report from the fields, and again, if you look at in the Manipur, all the development that are in the valley, because in the hill there's not much development happening around. If you look at in terms of health facilities and education facilities and infrastructures about sports or culturals or name anything, all the institutions, facilities, infrastructures are in the valley where the 10% geographical area. And in hill, there's almost nothing. Talk about the health systems. We have like the tertiary health systems like Regional Institute of Medical Sciences under central government in Imphal, and under the state government, we have Jawaharlal Institute of Medical Sciences. And there are private hospitals like CISA Hospitals and Research Institute, RAS Medicity, Imphal Hospital Research Center, Sky Hospital, Imphal. So all these tertiary healthcare systems are in the Imphal. And in the hills, there are almost nothing. Only in 2022, there was 1 medical college was established in Chorchampur district. So out of the 10 hill district, this is the only medical college which also just started on 2022. And they just have barely any facilities because it was just started, just launched in 2022. So apart from that, all the facilities. So now you can imagine yourself, although there were supplies in terms of medicines initially, but it all was lying in Imphal region. So people in the hills are not accessible. And it says that about 50 unidentified newborns and children were left behind by their parents, and they were kept in a home. So, and then the Kuki, Kanlai, Lompi, they also says that approximately about 39 people those lost their life, including 2 babies in different relief camps. And this is all as per the 3rd May, and the number keep rising after that. And as per the SHCC report, this is another organizations who have done a survey that at least there are about 24 incidents of violence against the healthcare systems, 7 incidents where health supplies were looted, and 6 incidents damaging health facilities like the PHC and pharmacies and other clinics. And let me quickly present some cases. It is reported that about 50 deaths occur due to disease and illness in the Hill district. This is mostly in the Hill district, out of which at least 35 people died because of lack of medicines and poor living conditions at relief camp. And so there was not timely treatment, medicines were not available. And again, as I already mentioned, all the tertiary health care systems are in Imphal. So all the specialists and super specialists are in Imphal, or from Imphal, they were posted in the hill area. So when the conflict started, the 2 community, the Meitei and the Kuki and Jaw community, as there's a divide. Now they cannot, Meitei cannot stay in the hill district, or Kuki Jaw community cannot stay in the valley. So now they have to go to their own respective district and location. So, and most of the health facilities and the healthcare professionals are based in Imphal. So the hill people have shortage of medicines and the healthcare professionals. So this is another issue. And another case is Mrs. Mother lost a 2-year-old son because he did not get medical care in time. So this is in relief camp again. And one named Neilang, she was 8 months old pregnant when the incident happened. And then she has to run, and they stay overnight in a forest. So, and then next morning, they were able to walk and find some help from the villagers. So these are some of the incidents I would like to highlight. And again, Chaubi, name change, she had a bullet wound. This girl, I personally met her in the relief camp, and she is the breadwinner of a family. Her husband is an alcoholic. She has 3 children, and she is totally depressed because how is she going to support her family? Now, she is the breadwinner, she is wounded, and she is in relief camp, not able to do anything. And so that's the kind of situations. And 12-year-old boy, Lim Kopau, is battling for blood cancer. He can access treatment because the only doctor who can treat him are on the other side of the border. So these are the kind of situation. And a 1-year-old girl from a relief camp in a government hospital died in the Hill district. Okay, the diet is missing. So these are few. There are many of these such cases, but I just want to highlight a few cases just to bring it into this group, that how serious the issues is, how deteriorating the health systems in Manipur. And for some concerns I would like to raise in this group is right of the affected peoples are hampered, they're violated. Their right to timely and appropriate healthcare is compromised. The international law talk about specifically protecting the right to healthcare. And as I already mentioned, there are about at least 24 instances where the healthcare worker or systems are attacked. And I remember even doctors who were not belong to these 2 communities, but they were attacked on their duty. When they go to duty, they were not allowed. Their vehicle were stopped and they were not allowed to go to hospitals. So such cases happen, attack of healthcare worker, and the basic needs are not met. We talk about the food, health need, and nutrition, safe shelter, water, sanitation, hygiene, and protections. And as per the spare standard and core humanitarian, they talk about, for example, a shelter, 3.5 square meter. A person should get that much space in the relief camp. But if you go to Manipur, you will see in a small room, in a small hall, there are 80-100 people lives, and it is reported that in the initial phase, in the Imphal area, there are about 12,000 people, and they were put all in 2-3 relief camps. So you can imagine the situation. And about talking about toilet, this situation has been now 14 months, and as per the spare standard, it says that there should be a toilet for 15 to 20 people, 1 toilet for 15 to 20 people. But again, in the relief camp where 100 people, there are only 2 toilets, and there are specifically toilet for male and females, and the ratio is for 1 toilet for 10 female, 1 for 15 male, 1 toilet for 15 males, and those kind of standards, it's nowhere. And food, we talk about nutrition, 21 calories in a day, but mostly they get only rice and dal and potato. And as we speak to people, when is the last time you had a non-veg? And some of them can't remember. It's been a month. It's been a month. I didn't even eat an egg or a piece of chicken or fish. That's what I've been eating, only rice and dal and potatoes. So those that's the situations. Even today, if you go to there are about still there are many people in relief camp. Few of them has gone back, but again, the situation is still, as I say, is still very grim, and most of the people are in the relief camp even today. And about water sanitations, as I already mentioned, there's no safe drinking water, there's not enough space, there's not enough toilet, and that also make the protections issues for safety in terms of our women and children. Most of the men are in their village, guarding their village, and most of the mothers are on the road protecting themselves. If you go to Manipur, you will see the women groups are guarding on the main road, making sure that the enemies are not crossing to the border. So there will be women group on the roadside protecting, and mostly the children will be in the relief camp in the daytime. So that's how the student male will be guarding as a volunteer. They'll be guarding their village. So in terms of protection, again, people are exposed. They're vulnerable. That's why we have seen reported some of the sexual harassment cases, and in the media there's about the naked parade and the rape, and also it's happening. And again, yeah, talking about access to health service, the 3 A's about availability, acceptability, and affordability. So it's almost nil. That's not available to the healthcare system. In the hill, we talk about the district hospitals are more of like a CHC, a community health centers. In the district where we work, in Kaksin and Kampopi, the district hospitals, there's not almost not facilities at all, and even the manpower. So there was a situation, gender-based violence, as I already mentioned. And so this also raised to the medical ethic. The doctors not really willing to treat the other community, the enemy community. So those incidents were heard. And dead body management, where is the dignity? Some of the dead bodies are still missing, and they don't. And we have seen in the media, people head were choked, beheaded, and choked, and so it's put in the media with holding somebody's head, or those kind of issues. And of course, lack of workforce. This is where KHADIJA also talked about lack of workforce in the state, and lack of political goodwill. So these are a few concerns I have for all of us. And in our medical camp, some of the main health and psychosocial issues we come across in terms of physical illness. These are the kind of cases we have come across. This is as per the report that we have collected from our doctors. So I'm not going to read it. And in terms of psychosocial care, a lot of psychosomatic cases, and people are under depressions and the post-traumatic stress, sleeplessness, they are fear, they are feeling lonely, extreme loss they feel, and feeling of helplessness. And so all these issues are come across by our team. So EHA Emmanuel Hospital Associations, Humanitarian Response in Manipur. So we have, since, as Dr. Anand already mentioned, since last 9 months, we have been there, and we have intervened in terms of health, provided food and nutrition, non-food items, and temporary shelters. We have done a lot of provided counseling to people who are affected, and also training and health teachings. So these are some of the sectors, the work we have done in Manipur. Sensitively, we have worked on medical support and the psychosocial care, especially last 8 months, we have been working. This is, again, joint initiative with EHA, CHSR, and Dr. Anand and Dr. Ramni, and a few of us. So these are few statistics. I will not skip it. So again, EHA follow the principles of we're making sure that we are organizations where we follow this principle of humanity, neutrality, impartiality, and independence. Especially in these situations, I myself being from Manipur, so it was very tough for me, because I look like any of the other community, either this side or that side. So I have to be very careful and make sure that we, as an organizations, we are neutral. We are not we are impartial. We are not partial to any side. So we have covered as an organization. We have responded to both the community, and we have provided our relief and our services to both the community. So this is briefly all I want to share. And so there are lots of war, but I would also like to show Manipur is a beautiful place. It's not all war, but there are good things. So I will request all of you, if you want to visit, let us know. And also EHA, we work in Northeast in Central India. And if anybody want to volunteer or want to come and work in our hospital, you are most welcome. Thank you. That much from my side.
Thank you. Thank you, Shem. I think we can open the session for any questions or comments or discussion. Yeah, I have a question to start with. Like, what was the response of the system, both the healthcare system and the government to your intervention in Manipur?
Yes.
How did they respond? How did particularly the government healthcare system is sort of, I know that it's slowly expanding, and the private system you mentioned, and also the government in general.
Yes. So in the valley area where there are facilities, the response is much better. But in the hill state, in the hill districts, right, especially like in the Kampopit, for example, when we went, there was almost nothing, because if you look at the map of Manipur, all the supplies goes to Imphal, and then from Imphal it goes to other district. So there's shortage of supplies. Even the government cannot, they're unable to transport the supply. For example, the army, the paramilitary, they try to transport few food items and medical supplies from Imphal to Chorchampur district and others in the hill district. But people stop, even the army, they were not allowed even to carry their own dry rations. So the army has to drop their own food by chopper. They were not allowed to carry. So such is the situations they were in initial phase. And then people has to look for medical facilities to other states like Mizoram and Nagaland and Assam. So that's how, and the response of the Manipur government has been poor, very poor. And also as a state, the government is not prepared for this kind of situations. So as I talk about lack of workforce and trained workforce, even among the government staff, so I think that has been observed.
I requested Priyadarsh and Randall of MFC. Both of them worked in Manipur, and they were requested to join and to make their comments or their contribution. I don't know whether they are there.
And there is one person who's raised his hand, Punita.
I think Randall can go ahead first. He will have the fresh information.
We don't know whether he is around.
Okay, so I just wanted to ask Shem. Hi, Shem. It's been we recently met also. So I just wanted to know, because I visited there in August, and I found, like, in both the camps in Valley as well as in the cookie camps, there was a lot of accessibility to the NCD drugs, especially for the diabetes and hypertension were not available. And we put forward this thing to the administration also. So what is the situation, how this is now being addressed, whether it's being addressed or not, and also the concern for the patients who had tuberculosis and other chronic illnesses. So what is the flow of accessibility to the drugs? What is the situation change in this at present? Thanks.
Yes. So yeah, again, last 2 weeks back, I was in the Hill District in Kampopi and Kaksin, and I met the chief medical officers in both the district, and they still express that there's lack of medicines, like especially the chronic illness or diabetes and the others. So it appeared that even today, few people who are in Imphal, they're accessible to the supplies, but in the Hill District, it is still there's shortage of this kind of medicines. Of course, there are a lot of donations has come from across India, from various states and from neighboring states. A lot of supplies in terms of medicines has come, but I think still there's not equally distributed somehow, even today.
Thank you. Brunella, how do we pronounce your name, Brunella? It's Brunella.
It's Brunel.
Brunel, okay, please. Go ahead.
So I just want to say I was in Lamka or Churachandpur in July. Have been over a period of time I have continued my association, and then went as part of a citizens tribunal to Lamka and Imphal and Kankopi. And this was between the 27th of May to the 3rd of June. And, the situation with regards to healthcare continues to be very, very critical. And while we appreciate the role that civil society has played, and also, faith-based organizations and institutions, I think collectively we have, not really put adequate pressure on the government to improve, health governance and services and human resources in the hill districts. And because of that, there is a huge crisis. There is a huge crisis of human resources also because most of the doctors and technicians in the hill districts were also Maite. And because of this displacement now, there is a shortage. And Manipur's health system, I mean, was anyway to begin with very, very inadequate. So, and what this medical officer from Saikul was saying that all the newly established districts, their health systems are very, very underdeveloped. And many of them had to, like Kankopi and Tengnupal, for example, these were the affected districts now with a very, very underdeveloped health system and human resource capacity. As our friend recently said, the district hospital is more like a CHC. They had to respond to very, very grave, challenges in terms of emergency and critical care that was required because of injury, burns, gunshot wounds. NCD care is still quite inadequate, and those with any kind of resources are moving out to the state. So actually it is those without resources, the ones in the camp are the ones who are really who don't have much social capital, and they are the ones who are the most vulnerable, and those who have stayed back, and those who are obviously staying back. Like, for example, the Cycle CHC doesn't even have a USG. And so you can't even do and it's a first referral unit. So it's not as if it's a non-first referral unit. So and a first referral unit as per IPHS standards has to have a USG. They can't provide quality antenatal care in the absence of that. Recently, the courts have also pulled up the Manipur government for, about a prisoner, Kuki prisoner in Imphal, who did not have, whose healthcare needs, he had TB and some other complications, and he was not given access to medicines. We know because we had people deposing before us that people in ambulances, okay, and this was a well-recorded case. This family came to depose this man. A Kuki man married to a Methi woman. Her son got a bullet injury, and while the Assam rifles were, accompanying them, and later on the Manipur police crowds stopped the ambulance and pulled them out, and they were burnt to death. So even emergency services have come under, like ambulances and all have come under this thing. So I think while we do, respond as civil society, as healthcare institutions, I think collectively now, and especially the health fraternity and those of us who believe in the right to health, and in all situations and contexts, must put pressure on both the Manipur government and the central government to ensure that there is greater equity in terms of access and services across the state, and that, health services cannot be compromised. And even if there are blockades, the state can airlift, the state can find ways of reaching medicines, but no one should have to, die or suffer because of lack of access to healthcare.
Thank you for that comment. Anyone else want to ask a question? Akbar sir, please.
Shem, is this not an ethnic conflict rooted in unequal development between the valley and the hills, rather than a religious conflict as is often projected in the media?
Yes, it is. I think it is more of a ethnic conflict, not a religious one. Of course, out of anger, people has damaged a lot of religious structures. Again, that is mostly because the Christianity has been spread from the hill to the valley. So there's a anger. There are a lot of Christians among the Métis. So the Métis themselves have destroyed a lot of churches because they thought that those Métis who are converted into Christians are kind of supporting the hill. So I mean that, yeah. So it's more of a ethnic, but not really religious. But out of anger, they have destroyed the religious structure.
Thank you. Thank you very much.
Shall we conclude? If there are no more comments, maybe Shem, you can make a final statement or comment or concluding remarks, and then we call it a day.
Okay. Yes. So there are a lot of needs, as Brynel already also commented. Yeah, I want to echo her that we need to put pressures on the central government and also state government from whatever source we can, because I feel that if government is really serious about this, they can really control even the ongoing violence and also stop this violence and also provide a lot of relief and other facilities to people. So that's one thing we can all do it. And then we need to establish the healthcare systems and other system especially in the hill district. So that could be another concern. If anybody is willing to help, you can contact. We still have some program. We want to intervene long-term developmental livelihood and training. So if anybody is interested, yeah, we can work together. Thank you.
Okay, thank you very much. So we'll meet again next Thursday. Bye. Good night for the time being. Bye.
Thank you.
Good night.
Yeah,
Thank
somebody
you
is
very much.
asking for your phone number and email
Okay,
ID. Shem, if you put it in the
right, yeah, in the
chat box, and then yeah.
Thank you, everyone. And we are grateful for the kind information given to us, which were not available to us. And if there is anything we can do, please let us know. And I am ready to do it. Thank you.
Great.
Suresh, can we have your number?
9650.
1 minute, let me write this. 9650
61
61
41
41
41.
41. Okay,
I am
9650
from JNU.
41.
I am from JNU and
Okay.
Dr. Sudhir Kumar, based presently in Delhi.
Thank you. And
I'll
thank you once again, KHADIJA and Shem, for those wonderful presentations and generating a lot of discussions and also asking questions. Like basically, you were presenting problems before us and asking us what we can do about this, because that is a challenge. Good. Thank you very much and good night.
Thank you. Thank you, colleagues. Thank you, Pranella. Bye-bye. Bye.
Good night.
Bye.
Right.